Hello everyone, I'm Dr. Santoshi, consultant dermatologist at Aesthetica Veda, Whitefield, Bangalore. I want to talk about acne and the psychological impact of it. Acne is primarily a pathology of the pilosebaceous unit characterized by inflammatory lesions and non-inflammatory lesions, which are actually inflammatory in nature when checked under the microscope. So inflammation is at the very core of acne, and notwithstanding the cutaneous effects of the disease has a very profound psychosocial impact. Many sufferers of acne vulgaris have also been found to have comorbid depression and anxiety. They can also have severe social withdrawal, negative body image perceptions, loss of confidence, self-esteem, and a poorer quality of life compared to their peers. Treatment of acne has to take into account this psychological impact that the disease can have, and the patient's perspective should be at the very core of the treatment plan. What we physicians perceive as relatively mild acne can have a devastating impact on the patient's life. So the patient will essentially be suffering from severe comorbidities in association with the disease. So we cannot trivialize it according to objective clinical scores. There's a lot of variables at play when it comes to the causation as well as the severity of acne, and diet, the environment, and of course stress levels. So a prescription to just treat the skin manifestations of acne would be incomplete. Ideally, we should have a holistic approach that takes into account the psychosocial impact, and there are very implementable ways that you can employ in your clinical practice to help patients with acne. Cognitive behavioral therapy, dialectical behavioral therapy, and music therapy and other relaxation techniques can be employed. These will result in reduction of inflammatory markers circulating in the patient's bloodstream and overall reduction in the severity of the lesion count. Of course, further clinical studies are warranted in this area, but there's no harm in trying these adjuvant therapies because they have been proven in other areas to bring down the stress levels of people in general, and we all can benefit from some stress reduction, right? So music therapy, guided imagery, mindfulness, and guided meditations are available. There are plenty of resources available. So talk to your dermatologist if you are suffering from acne, and if it is wreaking havoc on your social life, do talk to a dermatologist for further psychological support. And there is no shame in seeking psychological support for anything for that matter.